Assalamualaikum warahmatullahi wabarakatuh. My esteemed conference committee and all of audience, allow me to present my article with the title "The Direction of Innovation of Antibacterial Agent in Preventing Infection in Wound." Before I continue to present my article, I will introduce myself and my team. My name is sodiq and my team, the first is Estrin Handayani, and the second is Alfian Sarifudin. Before I continue my presentation, I will apologize because my device cannot slideshow my article before because not support. Okay. Wound is a condition, uh, one of the uh, health problem. The condition is disruption in the skin integrity. And this condition lead to the risk of infection. And the infection lead to the various impact on the patient life in the form of a long treatment period, patient discomfort, physical complication, and economic impact. This condition is need the innovation in antibacterial wound dressing. In the several articles show us that there is a 88.2% of isolate from wound detect the one bacteria resistant to antibiotic, and the number is very high. And we found that from this article that 29.2% of isolate was detect a case of multi-drug resistant bacteria to the antibiotic. From this article, we know that the resistant bacteria is the one of the main problem in the management of wound healing. In the other article, show us that we found the diabetic condition in patient is more likely to the MDR, the multi-drug resistant. We found the number about 63.4% of DM patient suffer the MDR. So there is the multi-drug resistant organism that the one of the healing problem in the diabetic person. From this article, we know the pattern of bacteria that isolate from the skin wound infection. The most type of bacteria is the Staphylococcus aureus. Method from this article is a systematic review. My team extract the article from the database ScienceDirect and PubMed at 27 July 20 and 21 with the keyword is antibacterial wound dressing and randomized control trial. The inclusion criteria is article published at period 20 and 16 until 20 and 21. or a 5-year period. From PubMed, I found 31 articles, and from Science Direct, we found 752 articles. And then we select the article according to appropriateness of the title and abstract. The article must contain research using wound dressing and antibacterial agent. And the result is 2 articles from PubMed is appropriate, and 6 articles from Science Direct is appropriate. The total article we analyze is 8. From our analysis, the X article, we found that antibacterial agent study from 2016 until 2021. The first is silver sulfadiazine or SSD, and the second is acetic acid, and the third is type of bacteriophage. Bacteriophage is the like a virus that against bacteria. And then the alkyl carbamoyl chloride or the ACC. The ACC is the one type of the material bending bacteria. And then silver form, the content is the silver nanocrystalline. And then the silicon or topical silicon gel. And the last is a combination of herbal extract that mentioned as a Yasaman fly or YASP that contain Garcinia mangostana extract, Orisa sativa, Curcuma longa, and Areca catero. From this article, from all of the articles that that we analyzed, we found that there is no new antibacterial agent in the period of 5 years. And the finding is the 6 article, the 6 antibacterial agent show the positive result, the effective to prevent the wound infection. That effective to prevent wound infection is the silver sulfadiazine or SSD, acetic acid, bacteriophage, TACC, silver, and Yasaman fly. And the 2 articles use the antibacterial agent mupirocin and topical silicone gel, not effective to prevent the infection in wound. The conclusion is there have been no clinical new antibacterial wound dressing raw material for the last 5 years. So there is no clinical trial that using the antibacterial agent combined with wound dressing in 5 years. But we found that there is the future and prospective antibacterial dressing type to develop. This type is bacterial binding material or material binding bacterial dressing. And the example from this material binding bacterial is use of DACC and ETC. This method, why we conclude that this method is the prospective method to prevent infection in wound, because this method does not generate the multi-drug resistance. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.